Hi, I'm Kim Adams. I'm a busy mom of 4 children and a journalist whose child has personally received care here at the Children's Hospital of Michigan. I don't know about you, but when my child is sick, I want every bit of information I can get to help them feel better. This pediatric medical moment is intended to give parents more information about pediatric health issues from the experts right here at the Children's Hospital of Michigan, where everything they know and everything they do is just for children.
Dr. Tanya Touchstone is on the medical staff in the emergency department at the Children's Hospital of Michigan. She says going to urgent care versus the ER depends on the type of injury or illness your child is suffering from. Let's start with those that definitely require a trip to the ER.
So for emergency department, I think of more of trouble breathing. Emergency department. If you have bleeding that you're not able to stop after having direct pressure for about 5 or 10 minutes, depending on where it is, then you go to the emergency department. If you have a sudden onset of confusion, dizziness, change in mental status, that's definitely emergency department.
Adding to the list of ER trips, head injuries of any kind, especially with vomiting, deep, long cuts, fever in children under 6 months, bug bites that cause trouble breathing or swelling of the tongue. And when it comes to vomiting and diarrhea,
with vomiting, if you have where your child is having severe worsening of vomiting or prolonged vomiting or diarrhea and they're looking seriously dehydrated, then that's emergency department.
And the list for urgent care, ear infections, colds without fever, and
if you have minor cuts or minor bruises, or say even if you were bit by an insect and it's like some local reaction and you don't know where to go but everything else seems to be fine, go to the urgent care.
Finally, if you're unsure whether to go to the ER or urgent care, it's best to be safe and go straight to the Children's Hospital of Michigan, where you know you're in good hands.
The majority of the doctors that work in the emergency department are board certified pediatric emergency medicine physicians.
Hopefully this answered some of your questions about going to the emergency room versus urgent care. Hopefully you won't have to visit either one, but if you do, the Children's Hospital of Michigan is the place to go. If you'd like to make an appointment with one of our physicians here at the Children's Hospital of Michigan, you can always call 313-745-KIDS.